Hi, everyone. Welcome. Thanks for being here. My name's Jen. I wanted to pop up this quick poll for you guys while we wait for everyone from the waiting room. There we go. I'd love to know where you're from and what your profession is. I am a dietitian and I am from Canada. And Emma's here to help me in the chat as well. Thanks, Emma. I'm not sure if you guys see that poll up there or not. Try again. There we go. I see you guys in the chat. Hi, Chelsea, Texas, SLP. Carrie's a dietitian from Canada. Oh, Nebraska, Erin. Hi from BC. Okay, thanks. The poll must be working now. That's awesome. A couple more dietitians. Looks like a mix of Canada, the States, Dubai. Awesome. Puerto Rico, Philadelphia. Great. It looks like we're from a mix of locations and a mix of healthcare professionals. So welcome to the Americans and Canadians. Looks like most of us are dietitians. We have some OTs, we have some SLPs, we have some other. That's awesome. Thank you for letting me know. So as we go along today, feel free to type in the chat, have a discussion. If you have a specific question, try and post that in the Q&A. And I actually recorded today's presentation so that I can be present with you guys in the Q&A. It's only about 35 minutes long, and then I'm going to come on at the end and answer some Q&A live as well. So we should have about 10 minutes for that. So hopefully everything is wrapped up in about 45 minutes. So those of you on your lunch break have a little chance to maybe pop outside. So thanks again for being here. We will get going. So make sure I'm sharing the right screen for you guys here. Awesome. Welcome everyone to today's webinar, Sensory Strategies for Picky Eaters, Practical Tools for Healthcare Professionals. If you have a question, please post it in the Q&A rather than the chat, but you can use the chat throughout for comments. I know that there's lots of experts here today, and I'd love to hear from all of you. So if you've ever felt like you should know how to help a child with severe picky eating, but you find yourself stuck, second guessing your approach, not seeing any progress, you're in the right place. By the end of the session, you'll understand why traditional treatment for picky eating often falls short and how to approach these cases in a way that feels more clear, more effective in your work. And towards the end, I'll also share details about the Pediatric Feeding Network for healthcare professionals for those of you who want more support in applying this to your practice. So hello, if we haven't met, my name is Jennifer House. I help pediatric healthcare providers move from feeling qualified and stuck to confident and competent when working with picky eaters or kids with ARFID or pediatric feeding disorder. I'm a mom of 3 kids, one who was a very selective eater for years. Unfortunately, we're not immune. I'm a registered dietitian with a Bachelor and a Master of Science in Nutrition, and I've owned First Step Nutrition, my private practice, for 18 years. I have extensive training in helping selective eaters, including K2ME sequential oral sensory training. And I believe that raising happy, well-nourished eaters who have a healthy relationship with food doesn't have to be the battle that it often becomes. And that's why I created the Pediatric Feeding Network to help dietitians and healthcare providers uncover why children struggle with eating and apply practical strategies to help treat severe picky eaters. I have my website and my Instagram for healthcare professionals listed here if you want to reach out or follow along. So first of all, you might be wondering, is this even in my wheelhouse? Why do I need to learn about sensory if I work with selective eaters? So this is from the Sequential Oral Sensory, or SOS, website about why it's important for all healthcare professionals to learn about sensory. Because it teaches professionals to think about food from a sensory and oral motor standpoint. These are the things that make the children unable to eat the nutritious food that dietitians recommend to families. So I know as a dietitian, which many of you are as well, we often focus purely on growth and nutrient gaps and filling those nutrient gaps, which we need to continue doing, of course, but if the child cannot eat the foods we recommend, that's going to be a problem. And I don't expect you to go out and perform feeding therapy yourself after this short training, but knowing that these challenges might exist and affect feeding and the red flags and who to refer to helps to deliver high quality care and helps us to participate in that multidisciplinary team as well. So before we delve into sensory processing and eating, I find this is where a lot of practitioners get stuck first. We focus on what a child should be eating, but if we don't understand why they're struggling with eating, our recommendations won't make positive changes for the family. So often in school, we're probably taught the division of responsibility in feeding if we're lucky, but not much beyond that. And there are lots of reasons why a kid might have difficulty eating beyond that broken division of responsibility. These are just a few, including physical pain. So if the child has reflux, constipation, cavities, or allergies, they can experience pain with eating. And then that basically overrides their appetite, so they become conditioned not to eat. So not all children will listen to their appetite. Oral motor skills. So this refers to the movements of the muscles in our mouth, jaw, tongue, lips, cheek, basically every muscle that we need for eating. And chewing is actually very difficult. Maybe some of you are eating lunch right now and can test this out, but once you take a bite, just think about where the food is in your mouth, how you move it from side to side, where you swallow it from. It does take a lot of coordination. Of course, this is the domain of occupational therapists generally, or SLPs. And the child might have nutrient deficiencies as well, such as iron deficiency, which is pretty common in selective eaters, and it can lead to low appetite and poor growth. I experienced this with my daughter myself, and I'm convinced I stunted her growth. So, if a child doesn't eat many iron sources, if they're often sick, fatigued, pale, those could be some signs they need to get their iron tested and supplement. That broken division of responsibility in feeding, we know those family roles, added pressure, lack of schedule can make the selective eating worse. And then another one that I actually learned when I was on a home visit with an OT is difficulty breathing. This also makes it challenging to eat. For example, maybe the child has enlarged tonsils. And if you can't breathe well, you're going to have a lot of troubles eating. And these kids are often mouth breathers, or maybe they snore at night. And of course, there's sensory. So we do go deeper into all of these underlying factors from the assessment treatment point of view inside the Pediatric Feeding Network. And secondly, again, before I jump into sensory, while many of the network trainings focus on strategies like improving these oral motor skills or expanding food selection, again, they're not going to be successful if the child feels unsafe at the table. So this kind of reframes your role in terms of how do we get the child to eat, to how do we help the child feel safe enough to engage at the table. And we also need to support parents with this at home too, with decreasing that pressure, because a dysregulated parent just leads to a dysregulated child. I like this quote that the most contagious emotions are calm and panic. And that's from Lindsay Beckerman, an OT who taught a class inside the network on polyvagal. So we do go deeper into concepts like felt safety, as well as supporting parents, which I find is the major roadblock for a lot of practitioners working in pediatrics, is the parents. Okay, so that was a bit of a side note, but really important, I think, background information to know, and there is a lot to learn here. But sensory processing. So sensory processing is the neurological process that organizes the sensations from our body and the environment, and then makes it possible to use the body effectively in that environment. And sensory processing disorder affects about 1 in 20 people. And SPD is not a diagnosis in the DSM, though many have been arguing that it should be, but it's very common, especially in kids who are neurodivergent. And OTs are traditionally the profession that have the most knowledge and training in this area. I'm sure there are some OTs live here today, so thank you. Feel free to share, your expertise in the chat as we go along. But I do find, even if a child who's a picky eater is working with an OT, maybe at school, they may be working on different skills, and often feeding gets overlooked. So we have 8 senses in our body, and eating is the most difficult sensory task we do because it involves using all 8 of these senses. They include touch, sight, sound, smell, taste, and a few you might not be as familiar with. So there's proprioception, which involves deep muscle pressure and awareness of where our body is in space. So this would include the ability to get a fork to our mouth, to know that we need to hold a metal coffee cup with, different strength and more firmness than a styrofoam coffee cup, for example. And we have vestibular, which is balance and movement controlled by our inner ear. And then we have interoception, which is sensing our body's signals like hunger or needing to go to the bathroom. And a child or adult can be an over or under responder in one or more of these senses. So for over responders, their nervous system is very sensitive and they have a low threshold for stimulation. They feel the sensation intensely and they're often in flight, fight, or freeze mode. So therefore, over responders often appear anxious, cautious, defiant. And I have a few examples here of potential red flags for an over-responder for some of the senses. So a visual over-responder tends to prefer beige carbohydrates. If they have a favorite food in a specific packaging, they're going to notice if that brand changes the packaging. They might look away from food and dislike bright lights. A touch over-responder prefers a certain texture of food generally, usually crunchy. If they're young and they touch something wetter that they don't like, they'll finger splay like this. They don't like to eat with their hands. They prefer utensils and they like to wipe clean and keep clean. A vestibular over-responder might dislike being lifted up into a high chair. They might avoid drinking from a cup because it makes them dizzy, moving their head back and forth, and chewy food as well. They may not like because that can make them a bit dizzy. Taste over-responders may, shudder, gag, vomit. If they taste food that they really don't like, they might spit food out, and they tend to prefer uniform, bland, processed foods. And this is often why picky eaters prefer processed food. It's the same every time they eat it compared to homemade food, which varies a lot. An auditory over-responder might startle with loud noises, cover their ears, have troubles eating in loud settings like a school cafeteria, and they might avoid crunchy foods because these are quite loud when we eat them. And then on the other end of the spectrum, we have under-responders who have a very high threshold for stimulation. They often seem less aware than others and can be withdrawn and quiet. And some red flags, the food may fall out of their mouth. They might gag because they can't keep track of where the food is in their mouth. They may pocket food in their cheek or overstuff to try and feel the food. A lot of these issues could also be related to oral motor skills, so the child will need a proper assessment. They might prefer highly flavored or chewy foods, so totally opposite of the under-responders. Totally opposite of the over-responders. So the under-responders really like highly flavored chewy food. They're often unaware of strong smells, and they might be excessively licking, chewing, biting, or sucking objects. So in terms of like proprioception too, they often appear really uncoordinated, but seek lots of movement. So I've heard this put as like a bull in a china shop, right? Like they love that movement, but aren't really sure where their body is in space, so might be crashing into things. And an OT or maybe an SLP specializing in sensory will often diagnose and start treatment for these kids. Okay, so before we get into the table or food play session or even a family meal, we want to think about sensory prep. So we want to make sure the child is in the best and the calmest state for learning when they come to the table. And this requires some physical activity, which includes proprioceptive or heavy work. So just like a big hug, helps calm our nervous system, that proprioceptive or heavy work or physical activity will help calm their nervous system as well. So maybe this is running around the table 3 times. Maybe it's doing 10 jumping jacks before coming to the table. And then blowing bubbles or taking deep breaths. So this will encourage deep breathing, which, decreases our adrenaline, helps us calm down. If you use actual bubbles, which are great, say in feeding therapy, they're an extra sensory exercise and touching something that's wet and strengthens their lips using those oral motor skills to actually blow. So this bit of physical activity and deep breathing are also good to recommend to families to add to a mealtime routine as well. And if the families want bubbles at the table, they could use like pinwheels or blowing bubbles with a straw in their glass of water or milk, or just deep breaths could accomplish that task too. And, the deep breaths are good for everyone, including the parents. And interestingly enough, and before we get to actual food, even non-food sensory play can make it easier for kids to approach new foods at the table. So this is something that's also pretty easy to recommend to families. There was this one study on fruit acceptance in 100 young kids. So for 5 weeks, they were offered either food sensory play with fruit, non-food sensory play, a fruit taste exposure, or control play. And then at follow-up, both the sensory play group showed an increased enjoyment of fruits compared to the exposure or control groups. And the greatest increase in enjoyment was found in the non-food sensory play condition. So this is really interesting, even exposure to different types of textures of whatever it is, non-food items, helps the children become comfortable being exposed to new food items at the table. And even the non-food sensory play was more effective than the exposure. So, we hear keep on exposing them, and that's really important too. But, sensory play, if the child's sensory sensitive, is really going to add on to that success. So in terms of setting the table for sensory success, depending on the child's sensitivities, we want to make sure it's in a setting that helps to keep them calm. So for over-responsive kids, we want to be calm, speak in low voices, have like a clear setting, right? We don't want them to get overwhelmed. So we can have a reserved spot at the table for each person to remain consistent, use the same plates, have plain placemats, avoid glass tables. We can turn off the TV, turn off electronics, try and reduce clutter. Maybe we're dimming lights, if it's a visual over-responder. For under-responsive kids, it's kind of, again, the opposite. So we can use louder voices. We can use more exaggerated movements. We can have a mirror available so that they can see what's happening while they eat and get some feedback. And then if a child starts to become, unregulated or bothered or upset during a meal or session, we know that, again, bringing in some of those proprioceptive activities will help to calm them down and regulate them. So that might be tug of war with a rag or chewing on a rag, smashing foods between their hands or a napkin, squeezing purees out of a pouch, using like a kid-friendly knife to cut some of the food, or even counting like pieces of food can be regulating. So how do we get kids who have sensory challenges comfortable with trying new foods? So, in general, before we get to more specific food play ideas, I did share research around how that simple non-food sensory play can increase acceptance of new foods. So you can encourage walking bare feet in the grass, taking a bath with bubbles, or sensory bins with or without food items, starting dry and then working up to wet, like Orbeez beads or wet pasta. And any exposure to food, whether it's through gardening, cooking, picking out a new vegetable at the store, art activities, science activities, using food but not related to eating it. These activities all get the child looking at, smelling, touching different colors, shapes, and textures of food. And they count as a positive, no pressure exposure that is going to increase the likelihood that the child's going to feel comfortable around these foods and new foods at the table too. Okay, finally, moving on to sensory play with food, which can be called play with a purpose. You may be familiar with Dr. Kay Toomey's 32 Steps of Eating hierarchy. It's from her sequential oral sensory program, which is systematic desensitization with food. So the whole concept is really that eating is not as simple as just putting the food in your mouth and chewing it and swallowing it for some kids. First, they might need to get comfortable even looking at the food on the table or tolerating it. And it can make a big difference on pressure if we can just help the family to understand this. And then, the child might need practice interacting with the food, which might mean poking it with a fork, moving up the steps to smelling it, touching it, tasting it, and finally eating it. So within each step, there are multiple steps in the full 32-step hierarchy. For example, touch, they may start with touching it with a chopstick and then a finger, and then squishing it in their palm, spreading it on their lips like lipstick. But I just have the basic steps here. And then what a sensory focused feeding therapy might look like. So many of you might practice this yourself. Feel free to let us know in the chat how you normally practice. Often this type of feeding therapy is done in a team setting. The parent may or may not be involved. It can be one-on-one, or you could have groups of kids. It could be in a clinic. It could be in the child's home. So there are lots of different options. If you're referring to a feeding therapy program, I like to make sure it's more of a responsive versus behavioral program. So I never want to force a child to touch, lick, or interact with the food like some feeding therapy programs do. So applied behavioral analysis, or ABA therapists, appear to be changing, which is great to see, but they've traditionally used techniques like non-removal of the spoon. So basically force feeding, which I don't believe is going to lead to a love of food, a love of eating. In fact, it might do the opposite by causing trauma. So when we're, doing some kind of feeding therapy or food play with a child, we want to model a play action and let them imitate us. If they don't imitate us, we can come up with other things that might be more interesting to them in terms of how we can play with this food. Or if they come up with some way to play with it, that's great, then we can copy them. And then we'll switch to food when the play no longer has purpose. So maybe great, they've got to the top of the steps, they're eating the food. Maybe it's really bothering them and they aren't able to re-regulate with that food. So, okay, we stop that food and switch to the next one. So inside the Pediatric Feeding Network, which I'll introduce to you soon, we have 2 full sensory classes and go more in depth on each step, play ideas, food ideas. But I wanted to give you a few play ideas here today, starting at the bottom of the hierarchy of eating. So tolerating and then moving up to interacting with the food. So we could feed the food to a child's doll or to their stuffed animal, play peekaboo with food under a napkin or plate. We could pretend the food is a car driving by and then, up their body. We could use kitchen tools to interact with the food, moving towards using our fingers and palms. We have the child describe the food using their senses. And we want to take into account the child's age and their learning capacity. So this food play is going to look different depending on their cognitive developmental stage. So, we'll start with a young child maybe playing peekaboo. And then for a more developed child, age 5, 6 plus, cognitively, we can use some more of the explorer activities like describe how the food looks, describe how the food smells using non-judgy words. So in terms of what foods to offer, we generally start by getting a list of all the foods the child prefers or will accept. And then in a food play session, we'll start with one of these preferred foods, to kick it off on a positive note. And then we'll create a list of a few foods, ideally linking them by sensory properties. So there's no massive changes between the foods. I'll show you what this can look like in an example on the next slide. But after we play with the preferred food, then we'll introduce a new food that they don't normally eat, linking the sensory properties to that previously eaten preferred food. And then after the new food, we might go back to preferred food and then a new food and so forth to help them stay calm, going back to that regulating food in between. And so we present them with a piece of the food and model a play action and let them imitate us. If they can eat the food, again, or if they get really upset, we can switch foods or go back to favorite food or regulating food to help them calm down. Some ideas of regulating foods tend to be like chewy or crunchy foods. So that might be, again, their preferred food. Veggie straws. I put rainbow goldfish here. So rainbow goldfish or like Fruit Loops are actually more useful in play generally than like plain Cheerios or regular goldfish, just because there's those different colors to work with. Might be beef jerky, straws. So like, again, that deep breathing or blowing bubbles will help regulate them as well. Crunchy carrots, pretzels, so things like that. So we do case studies for each class inside the Pediatric Feeding Network. So I grabbed a few foods from a food playlist from our sensory case study, just to very briefly show you what this can look like. So these are the first 3 foods in an 8-food hierarchy that I created for the little girl in a case study. So we started with rice crackers, which are one of her preferred foods. So they're round, they're crunchy, they're white, and she has no troubles eating these, but we still want to introduce playing with it so that we can use these play methods when we're introducing newer foods. So maybe we roll it like the wheels on a car. Maybe we roll it up our body into our mouth and crunch. And then maybe the next food we try would be ikama. I'm not sure how to pronounce that, that white crunchy vegetable. So we could cut this so that it looks kind of like a rice cracker so that it's round and it's white. If we leave it out for a bit to dry, it has a dry instead of a wetter texture, which might be easier for her to handle. And then if we're starting play interacting with this new food, we could maybe mash it in a chopper or cut it into pieces with a kid-friendly knife. If we're working on touching it, if she's okay with interacting, we can work on touching it. So rolling it, again, like the wheels, like we did with her favorite rice cracker. Maybe we're able to roll it up her body again. Maybe we're able to lick it like a lollipop or hold it in our teeth. And maybe we get up to chewing it. So we could chew, spit it out, and count the pieces. And maybe she'll get up to eating it. And maybe we won't get all the way up to taste or chew before we switch foods, and that's okay. So maybe the third food we play with would be freeze-dried peas. And if these are a normal food that she eats as well, again, we could probably move all the way up to eating, or maybe we want to start with some lower steps just to introduce some new ways to play with food. So we could roll these peas back and forth. We could see what sound they make on our molars. So that's an example of 3 different foods, 2 preferred, 1 new food, and how we could introduce those and play with them. So I wanted to talk briefly about food chaining as well, and this is another method of introducing foods to selective eaters. It was created by 2 SLPs, Sherry Fracker and Laura Wahlberg. And food chaining is more of a home-based program, I would say, where food play is generally more practitioner-led. So food chaining, it's based on the child's food preferences and the relationship between these sensory properties and the sensory properties of other foods and liquids that we might want to introduce. So the caregivers are provided with food choices for the child, or essentially the food chain. If the child's old enough, it's great if they can be involved in creating this food chain. And then we analyze the child's response. So when we're introducing, these new foods in the food chain, we might need to reoffer the food again and again and again. Or if it's strongly disliked, we can figure out how we can change this food. Again, asking the child, if they're old enough, how can we make this easier for you to eat? Or maybe we just totally scratch that food off the food chain and move on to the next. First off, sort of like we did with food play, is to make a list of foods the child currently eats. And we want to know specifics, like do they eat only McDonald's nuggets or do they eat other brands too? And then these accepted foods are assessed for their similarities and senses like texture, temperature, smell, flavor, color. And that's called flavor mapping. So we use this information to flavor map. So this determines the flavors of preferred food, like maybe they like all sweet or salty or sour or spicy. Maybe most of the foods are strong, maybe they're mild. And we look at these other senses like texture. Is everything crunchy? Is everything soft? Maybe temperature we add in. And then we brainstorm foods that are similar to foods that the child likes. So we want the new foods in the food chain to be similar or linked in sensory properties to the preferred food. So it's not a giant jump. And then we'll also create a goal food at the end of the food chain. So you might come up with these goal foods after finding a nutritional gap in the child's food records. Like if they don't eat any vegetables, maybe a vegetable is their goal food, or maybe the child or parent has some of their own foods they'd really like to try. As some examples, so if the child only eats crunchy foods, we're going to have more luck expanding their diet right now by including other crunchy foods. So I've listed some ideas here. So that might be roasted chickpeas. It might be a rice cracker. We could put foods in between it to kind of make a cracker sandwich. It might be celery, which we could fill with different fillings. It could be freeze-dried fruit or veggie, which is going to be more accepted than the fresh for a sensory sensitive kid because every bite is consistent, as opposed to the fresh, which can change with every bite. One quick example, so if your child loves strawberry fruit roll-ups, we can create a food chain from this. And maybe our goal is fresh strawberries. So starting with the fruit roll-up, we could offer strawberry fruit leather. It's the same color, similar flavor, and just a slightly different texture. We could try store-bought fruit leathers, and maybe we could try homemade ones. And then once some fruit leathers are accepted, maybe we move on to those freeze-dried strawberries. Again, with that dried crunchy texture, it's going to be easier to accept than the fresh strawberries. But it's a similar color and taste to the fruit leather, just a different texture. And then maybe we can move on to fresh strawberries. And if we want to continue, why not try like strawberry yogurt or strawberries in smoothies if these are new foods? And of course, it might take many times, of offering these foods for the child to accept. But again, if the food is really disliked, we can figure out how we can change this or just skip it. So your work is important. As healthcare professionals, we play a crucial role in shaping how families experience meal times. We're often the person that they might turn to if they feel frustrated at the table, if the family's confused, or if they end up getting stuck. So the way that we approach these cases, it can really have a lasting impact, not just on what the child eats in their diet, but on their long-term relationship with food. So this was a pretty quick overview today, and I know it gives us a good starting point, but many of you might still feel stuck because knowing what to do in theory is one thing, and then knowing how to apply it consistently across different children, different families, different dynamics, different levels of complexity is where things can get much harder. So if you're listening to this and recognizing that even with the information or strategy, it's not always clear what to do in the moment, the real client, you're not alone. And that's exactly why I created the Pediatric Feeding Network. So for those of you who want more support with this, I want to walk you through what this could look like before we get to the Q&A. So the Pediatric Feeding Network includes trainings, support, and resources. So for some of the trainings I teach and others are taught by guest speakers, such as we've had a dentist, we've had OTs, we've had SLPs, parenting coaches, a child therapist, and some other expert dietitians. So every training includes a case study, so you're not just learning the concepts, but you're seeing how to actually apply them in real life situations. So you can see here the list of on-demand or recorded training topics from division of responsibility to autism, oral motor, ARFID, and parenting. So they're currently over 20. So whether you're working with a child where nothing seems to be changing, or you're not sure how to approach that tricky case involving autism or oral motor challenges, you have something to refer to and go back to instead of feeling like you're figuring this out on your own. But I just want you to know there's no need to binge all these or start from the beginning. It's not a course that you have to get through. It's a growing resource of library built to support you when these challenges do come up. We also have 4 live trainings per year. Upcoming live trainings this year are the next ones with Kelly Fitzpatrick and SLP, talking about GI disorders and how that impacts pediatric feeding. And then in September, we have Lauren Sharifi coming in, a dietitian, talking about safety before expansion, pediatric nutrition care for ARFID. And we also do have 20 plus CPEUs, so continuing education credits for dietitians in the US. A past member, Angie, said this network has been a one-stop shop for all things picky eating. The trainings have been invaluable, and I love all of them, including the rich discussions that we have. The topics presented are innovative and relevant. I'm so grateful to be part of this network. Thank you. Thank you, Angie. But it's not just about the content, you also get support, because I know what it's like to work alone or be the only dietitian on your team with nobody to ask questions to or bounce these hard cases off of. I specifically remember that, as a new dietitian working in a children's hospital seeing patients, I remember these specific parents that came in to talk about their child. The parents argued with each other the entire time. No progress was made. I think it was awkward and frustrating for everyone. And my only tool at the time was the division of responsibility, and I was the only dietitian on the ward. So I guess 20 years later, I created this network that would have provided me with a ton of relief years ago, because when you join, you have access to me by email at any point. Sometimes I'll hop on a Zoom with a member and chat through a case. We also have a private chat group for members, which are interdisciplinary, to share resources or ask questions. And I've also created a custom chatbot that's been trained on the network content to help you, so that no matter what tricky situation comes your way, you can get support. And this is often the piece that practitioners don't realize that they're missing until they have it. And I also have handouts and resources for you. So I have a pre-made picky eating presentation you can use with parents, so you don't have to waste time creating your own if you ever do group presentations. Customizable handouts you can use directly with clients, like a pediatric assessment form to quickly help you identify red flags, guide your sessions and referrals more effectively. And a few more examples here. So for older picky eaters, we have a food science homework handout. And we have a mealtime schedule and a transition activities cards to use, which can be especially helpful for kids with autism. And I was chatting by email a while ago with Jen, a current member, about some upcoming patient meetings she had. And she so kindly said, "Thank you so much for sharing all this information. Your ideas are incredibly helpful and have given me more confidence as I prepare for these counseling sessions." So I want you to move from feeling stuck or unsure about those complex cases to feeling confident in how you approach them and clear on what to do next. And I would love to have you as a member. So the purpose of the membership isn't, again, to overwhelm you with more information. It's to support you in your day-to-day work and give you tools that you can actually use with your clients right away. And as a bonus, this is something new, but if you join within 48 hours of this webinar, I've created a brief questionnaire to answer with your top challenges and your current practice details. And then I'll be able to point you to the top trainings and resources in the network that I think will be most valuable to you right now. So you'll receive a customized learning pathway tailored to your practice, helping you navigate the pediatric feeding network. So when you think about having access to that ongoing recorded and live trainings, real case examples, support, and practical tools you can use in your work. I believe that the network membership is worth thousands of dollars. I introduced it 5 years ago at a rate of $809 US, and it's only been built up from there. But today you can join us for $500. So you'll be able to lock in this current pricing and take advantage of the bonus again if you join within the next 2 days. So if this is something you've been wanting support with, I definitely encourage you to take advantage of that now. So you can scan this QR code if you're watching on a desktop and have your phone for USD pricing. And I'm going to post a link in the chat in the checkout cart for USD pricing. I'm also going to post a separate link to a checkout cart with Canadian pricing for Canadians like myself, because I am Canadian, so I understand. I also have group rates available. So if you work in a group like WIC or in a healthcare team, please reach out and I'm happy to speak to you or your manager about group rates as well. So at this point, you hopefully have a better understanding of how to navigate sensory challenges with picky eaters. But as we talked about earlier, knowing this and applying it confidently in real situations are definitely two different things. So if you're working with children where you're not seeing that progress you like, or you're finding yourself again second guessing, not sure what to do next, that's where the Pediatric Network is designed to support you. So when you join, you're not just getting access to training, again, you're getting that ongoing support, practical tools that you can start using right away, and a place to turn to when you're working through those more complex cases. So thank you so much for sticking around. And with that, I'm happy to stay on and answer any questions you have.
Awesome. So thank you. I'm going to answer Jamie's question. I think this is great in the Q&A. If you guys have any others, feel free to post them there. Thanks, Mel. Okay, so Jamie says, I've used food chaining with several families, but I think a lot of the times the parents have unrealistic expectations as far as how quickly their kids will start to accept new foods. Is there any recommendation as far as how often to present the next food in the food chain and or when to try a similar but different food? So love this question. First of all, I want to address parents' expectations. Because I think, like I mentioned, working with parents is often the most challenging part of working with the kid because they often, they don't really trust the process. They don't trust that their child's making progress or they don't see it. So I think it's really important for us to help them recognize the small progress. So one thing I like to do is to ask them to take a jar, an empty jar, and fill it with a marble, a coin, a nut, or something every time they see small progress. And progress might be the parent not asking their child to take a bite at dinner. The progress might be the child sitting down at dinner for 2 minutes. It might be the child poking a new food. It might be the child not crying during dinner, right? So it's not necessarily put a marble in the jar every time a child tries a new food. It's just helping them to recognize the small progress that they will be making, and letting them know that this is months to years long for some kids. It's not like they start working with you and then in a week they're eating 100 new foods, unfortunately. In terms of how often to introduce a new food in the food chain, I'd probably introduce one food a day. So for example, if you're working on trying strawberry yogurt, introduce a little bit of strawberry yogurt every day for a week, maybe for 2 weeks. And again, if there's no real negative reaction to that, you can keep on offering and exposing it to them. If there is a real horrible negative reaction and the child's old enough, you can say, how can we, change this so that it'd be easier for you to eat? And maybe they say, I just don't like strawberry yogurt, let me try a different flavor of yogurt. Or if they're not verbal like that, and it's the food's really bothering them and you can't really modify it, just skip on to the next food. So again, food chaining isn't a really quick process. And sometimes it is difficult for parents to understand that. It's a really big part of our work with them, I think, is that counseling and that assurance. Okay, so this kind of leads into Mel's question. When it comes to selective eating, what tips do you have on navigating parents who have different parenting styles, especially if they're separated and living in different homes? That is definitely a big one, and again leads into the parenting, and the parents maybe having different rules in different homes can really be confusing for the kids. So if it's possible, I would love to speak to, both parents in all the consults so that they're on the same page, so that they have the same information, and hopefully the child is getting the same treatment in both houses. I do actually have in the network a class called How Parenting Styles Affect Feeding Dynamics and working with different families with Sarah Rosensweet, who's a parenting expert. I'm actually taking her course on parenting teens myself right now, so we definitely address that inside the network. We also have a class, How to Work with Parents of Picky Eaters Who Have a Poor Relationship with Food, which can be another struggle, with Diana Rice, a dietitian, and effective strategies for working with challenging parents with three different parenting experts. So we talk a lot about understanding the parent perspective, like what is their fear, where are they coming from, using communication strategies like active listening, de-escalation, and always building that trust and rapport with them. And we work through, navigating common conflict scenarios that they have in their house and providing them with some problem-solving techniques. And then I think creating collaborative solutions is really important too, so that you all have aligned goals. You're not just telling them what to do, right? You're working with their goals and kind of empowering them to be part of that decision-making process. If you have access to, psychologists or social work or other parenting support, some families will really benefit from that as well, of course. All right, Angela says, what would you suggest looking into when a toddler doesn't have any clear refusal or aversions to textures or flavors of food? But I assume they're still a selective eater. So then there's probably another underlying reason why the child's having difficulty eating. Angela, I'm not sure what profession you are. Most of us are dietitians, so I would assume that, but perhaps you, yeah, okay, dietitian. So maybe the child needs an assessment by an occupational therapist or an SLP who specializes in feeding so they can assess if there's any oral motor weakness or difficulty chewing and swallowing. So again, it may not be sensory related, it could be oral motor. Sometimes that's a tongue tie. Again, sometimes it's difficulty breathing, which I didn't realize until I did a home visit with an OT and she looked in the child's mouth and said he has really big tonsils. And if you can't breathe, you can't eat, right? Sometimes, which you might be more familiar with, it could be low iron. Although my daughter had low iron when she was 4. And, I didn't really realize that link at that point. So sometimes the nutrient deficiencies, low iron leads to poor growth. Sometimes they have cavities and it hurts to chew. Like there's so many reasons why it's difficult for kids to eat. Sometimes it's just that broken division of responsibility. So if, the parents are putting pressure on the kid, if they're snacking all day long, those are behavioral reasons that we can fairly quickly change within the family, but we're also looking for those underlying physical reasons. I find it challenging because he does like more challenging textures. Okay, so maybe that's a sign he doesn't have an oral motor weakness. That's good. So maybe there's, another physical reason for it, or it could be that I want to assess the division of responsibility. If you can't be in the home, I love to get a mealtime video because sometimes the parents don't realize they're applying pressure, but you can pretty quickly pick that up when you're able to watch a meal. Mel says, are these play-based techniques something you only do in person? I imagine that would be a deal, but could they work in a virtual session too? Um, So there are lots of different ways to deliver these play sessions. I assume at least during COVID, some feeding therapists started doing them virtual, and I think that could work. Could even do virtual group. Again, yeah, in person is probably ideal. But I have a program for parents of older picky eaters, and actually I just meet with the parents and introduce some food exploration. And that is a question too, for older kids, how do you deal with them? But they're more able to start to think about the food as a scientist and explore, okay, what does this food look like? What does it smell like in neutral, non-judgy terms? So depending on the child's age, there are lots of different ways you could do this. I think virtual could work. What's safe food alternative to suggest if a client with autism prefers extra salt over food? That's a good question. So if they prefer salty foods, then maybe you add extra salt to new foods, right? Or have them sprinkle extra salt on new foods. That would work sort of like a mask, which is that familiar taste added to new foods. And maybe they like foods like, beef jerky and chips, things that are crunchy and salty. You could use that preference to introduce new foods. So of course we don't want everything to have tablespoons of salt on it. Our recommendations for approaching food play or other table exposure in families with food insecurity or hesitant to waste food. Okay, this is a really important question. I was actually hoping this would come up. I made some notes because I've been hearing lately questions about also how do we approach this in cultures where they don't play with food, where it's very disrespectful to play with food. So I think there's a few different ways we could approach this. So, of course, we need to understand the whole family and their system and where they're coming from. And our recommendations are always individualized. So maybe they'll be open to it if you explain this is, systematic desensitization and we just use a little bit of food. Maybe as a therapist, you're able and willing to supply the food so they don't have to bring food in. And maybe you're able to send that extra food home with them. I don't know that, is really based on you and how you practice. If you feel like it's still disrespectful for them for whatever reason to use food in this way, maybe we can get them involved in other ways, right? Like um, letting the child help cook, grocery shop, wash produce, food chaining instead of food play. I had a therapist from Mexico say that in Mexico they don't spit. Like it's very disrespectful to spit. And sometimes in food play sessions, we'll have the child spit the food into the garbage at the end. So instead of that, she kisses the food goodbye. So, whether the family's coming from food insecurity or a real cultural respect of food, I think we can modify this so that it works for them. And if not, then we would have to find, some other way to work with them. But I like that question and it's difficult to answer, but really important. Awesome. Well, we are at 45 minutes, so this is the perfect timing to end. Thank you guys so much for your questions. They were awesome. I love answering those questions live. Um, just to the chat. Great. Yes, thank you, Emma, for handing the chat for me. Yes, I have lots of information for parents on my Instagram for parents is at First Step Nut, and my website First Step Nutrition has a blog on pretty much every picky eating question for parents. But thank you so much for being here. Hopefully, I'll see some of you inside the network. If not, happy to chat on Instagram DMs or by email anytime. Have a great day.